We have a successful case here using Bisoma Acupuncture for the treatment of neck pain, TMJ, shoulder pain, lumbar pain, and hip pain. She's female, age 26, student. This patient had 3 slipped discs in her neck, which caused daily radiating pain down her right shoulder and the arm. Additionally, she had a 1 millimeter slipped lumbar disc, which is not much. Perhaps she had a lot of muscle ache that was causing much discomfort there in the lumbar and also in the right hip. The skin on her right arm and right leg felt tight, as if they were adhering to the fascia. Both her right and left jaws were constantly tight. She had difficulty taking in full breath. She also woke up every morning with swollen face and felt that her right shoulder blade had slipped. She frequently used her right arm and body for waxing at work. So it's a physical labor at work. Waxing would be removal of hair of the clients. She experienced more difficulty exercising with her right side than her left. I gave her acupuncture right side yang horary points, Li1, metal point, UB66, water point, gallbladder 41, wood point, small intestine 5, fire point, stomach 36, earth point. There was no need for diagnosis because we're using Bisoma Acupuncture. She had a total of 17 acupuncture treatments. The first 7 visits were twice a week. After the first treatment, she noticed immediate relief into the following visit. And after the second visit, she noticed an overall 60% relief of her pain. As she continued acupuncture twice a week, all the pains, not at the same rate, but overall, had continued to improve in intensity, frequency, and duration. It was during the December time, so she went on a vacation for 2 weeks. She did not get acupuncture. And when she came back in January, she resumed acupuncture. And that was her 8th visit. By that time, she was still better, but the pains were starting to come back. So I gave her the same acupuncture protocol, Li1, UB66, gallbladder 41, small intestine 5, and stomach 36. She felt relief during the treatment, and it was still better into the following 9th visit. Continual acupuncture for twice a week for several visits, and then after that, she got acupuncture once a week. Now she's getting acupuncture every 2 weeks. And so then we've reached up to this point of 17 treatments. By the 15th visit, that was her visit coming in once a week, she reported 95% relief overall in intensity, frequency, and duration. Just to make sure, she received acupuncture 2 weeks later and acupuncture again 2 weeks after that. And she was still at 95% plus relief. That means it was pretty much gone. She did her exercises at the gym, and she did her work waxing. She's also a student sitting in the classroom. They did not aggravate that much, maybe just normal ache or tightness like everybody average what people would experience. So this was a good outcome for this patient using Bisoma Acupuncture because she had multiple areas of improvement. Even though she had 2 years of regular therapy, they were not helping her that much. But acupuncture helped her to recover from her problems. And so then the acupuncture points are important. The treatment has to be important. Specific acupuncture points have to be important. Her conducivity for improvement was also important. She was young and she did not have set in structural problem. It was mainly soft flesh issue. Therefore, the functional improvement was so much easier. And plus, she was highly reactive to acupuncture. That's why that third reason made it additionally successful for her. Now she's coming in every 2 or 3 weeks as a maintenance.